So you use the terminology meaningful access.
Basically, the laws are still in place. Title VI of the Civil Rights Act of 1964, Section 1557 of the Affordable Care Act, they continue to prohibit discrimination based on national origin, which has been interpreted to include language access. And the terminology that's used in these laws talks about meaningful access. To ensure meaningful access, we have to make sure that there is if it depends on how you're providing it, that services are timely, that they meet the patient's needs. Let me give you an example of and effective communication is the other term that tends to be used in a lot of this in the laws. So a lot of deaf patients will say, I do not want to use VRI. I'm going to wait for an in-person interpreter, or I'm insisting that you provide me with in-person interpreting services. And they say, I have a right to in-person interpreting services. And there's a little confusion there because what they have a right to is effective communication. So if VRI happens to be effective, it may not be your choice in your favorite choice in modality, but if it's effective, then according to the law, we're meeting your needs. Who determines if it's effective? The person using the services. So even someone who a spoken language individual who's using interpreting services, they may say, I'm not understanding this interpreter. They don't speak the same dialect I do, but you're both Hispanic. You just happen to be, one person is from Peru and one person is from Mexico. And we're not understanding each other. So what I am obligated to do is make sure there's meaningful access by maybe transferring to another interpreter that speaks a closer dialect. And back to the deaf community, labor and delivery is a really good example. Potentially, you might start off in early labor using VRI, and then as labor intensifies, you may need to switch to an in-person interpreter. Or opposite. I've had deaf people say, if one more person walks in this room, I'm going to, so they would prefer VRI. So there's not one rule or one size fits all answer for any of this. It really, the one answer is we are still obligated to provide meaningful access to prevent patient harm.
And in addition, it sounds like the patient is the one who decides if it's effective communication or not.
Yeah. And I think there needs to be a partnership between the healthcare organization and the patient. Yes.